everyone, welcome to our webinar today. My name is Leandra Mallory. I'm the program coordinator here at the San Diego County Breastfeeding Coalition, and we are just so excited you guys have chosen to join us today for this brief conversation with Dr. Shani. I saw that the chat is disabled for you guys, so I'm sorry about that, but again, thank you for being here. Just a couple little housekeeping things. If you have questions throughout the presentation, you can go ahead and put it in the little Q&A section. We are recording this webinar, so we'll make sure we get it sent out to everyone that has registered. So those of you that are here today, as well as those that were not able to make it. And then we are also going to be getting those DoorDash gift cards out to everyone. We end up having a big amount of people registered for this, and so we are so thankful you guys are here. Yeah, we're just going to go ahead and get jumped in. I'm going to just briefly talk about the San Diego Breastfeeding Coalition as well as the San Diego Lactation Equity Alliance. So the San Diego County Breastfeeding Coalition is a nonprofit organization dedicated to enhancing community health and well-being by promoting, practicing, and supporting breastfeeding. Through education, outreach, advocacy, and service, SDCBC works to ensure that all families in San Diego have access to the resources and support they need for a successful breastfeeding experience. And then the San Diego Lactation Equity Alliance is a Black-led nonprofit based in San Diego, working to make breastfeeding support more equitable, especially for Black families. They offer community care, education, and advocacy to make sure parents feel seen, supported, and empowered. You can learn more about their work at SDLEA.org. And then last, but especially not least, the reason we're all here today, Dr. Mama Shani is a doctor of acupuncture and Chinese medicine, full spectrum doula, and certified lactation educator, postpartum fan, and advocate for empowered birth and journeys into parenthood. Since 2017, she's been obsessed with the gut microbiome and menstrual cycles and what they tell us about overall health and wellness. From menarche to preconception through postpartum and beyond, her passions have taken her to China and Tibet to meet with mentors and experts to create a new approach that blends 21st century pharmacological, and 5,000-year-old tradition can be blended to create the ultimate results in modern bodies. She has used these methods countless times in clinics, and she nurtured her own body through fibroids, painful menstrual cycles, and even miscarriage. Going on to conceive naturally at 38 years old, to have a beautiful little boy who inspires her every day to share this information with anyone and everyone who wants a better way to conceive. Dr. Mama is your guide for preparing for and thriving through the birthing year and beyond. So good. Well, I'm going to go ahead and pass the baton over, and we are just so excited for this conversation.
Good afternoon, everyone. Happy Friday. I'm honored to be here. I am Dr. Mama Shani. Thank you so much, Leandra, for that awesome introduction. As you can tell, I'm very passionate about this work. I'm very passionate about empowering folks to be able to have the tools to take better care of themselves and achieve their goals. The main goal we're talking about today, of course, is lactation. And how challenging it can be, and how we can help support either families in your life or in your own relationship with your brand new little one, and help you feel more nourished in the process. So let's get started. There we go. So first off, let's ground and I'll get here. Take a nice deep breath. Close your eyes if you feel comfortable doing so. And acknowledge where you are in time and space and on this earth. And return to the present. Our goal here today is to reclaim postpartum as sacred, nourish the body to sustain the journey into early parenthood. I honor traditional Chinese medicine as as a part of the greater ancestral medicine that uplifts the body, mind, as well as milk. Um, why we're here. It's Black Maternal Health Week, right? This is a time that we all kind of pause and acknowledge that we have to do better. We have to do better by our community and by our families, in nurturing the next generation, and pick up some of the pieces that were dropped, as we lead into 21st century medicine. I think it's important to center Black birthing people because a rising tide lifts all boats. We know that when it gets better for some of us, it gets better for all of us. Um, Again, we're here to reclaim the postpartum space as sacred time, nourishing time. And I also acknowledge that traditional Chinese medicine, while that is the lens that I'm going to be speaking from today, and works along with other traditional practices. A lot of things were said by our grandmothers and great grandmothers and great great grandmothers, regardless of where the two grew in. And so they can offer us tools for nourishment, resilience, as well as reparative care. So what is traditional Chinese medicine, really quick? So we're all coming from the same language and the same understanding. 2,000 to 5,000 years of history. That was the main difference with Chinese medicine is that it was written down somewhere and taken care of over lifetimes. Chinese medicine is really all about balance, bringing the body back into what we would call in biology homeostasis. In Chinese medicine, we use words like yin and yang, qi, which is the vital essence of the body, blood, jing. Jing is that substance that is created at conception, that DNA material, that mitochondrial material that we bring into this life, versus the chi that we can change with the way we eat and how we breathe and how we move it in the world. Um, I really love the medicine because it puts a lot of focus on the reproductive cycle and individualized care and looking at reproduction and the menstrual cycle specifically as a messenger for what's happening greater in the body. And because we know that the body is supposed to do certain things at certain times. And when it's not, that tells us as a whole what's happening with this body and how we can bring it back into balance. And again, I always want to emphasize that even though I am speaking a lot from the lens of traditional Chinese medicine, I am fully aware that the more I learn about traditional postpartum and birth techniques and skills, that so many of our lineages actually coalesce and blend beautifully together and say a lot of the same things. So please and keep that in mind as we move forward today. So the time in our life that we're looking at is what's called in Chinese medicine, zuitzi. It's the sitting in period. It's that immediate postpartum, 30 to 40 days after birth. It's a time when rest is crucial, warmth is important, nourishment is vital, and emotional holding for, as we know, your hormones that during this point in time are falling off a cliff, as some like to say, as we have nourished and nurtured the body to create life over a span of months. And we know from just the biology of it all, the body has prepared for lactation since the end of the first trimester of pregnancy. So when we're looking at issues and solving for issues of being able to produce enough milk to sustain the baby, the body theoretically has had the tools since the end of the first trimester. So what's happening in that post-birth space and time can go a long way into understanding how we can nourish that time and improve milk supply, improve that nursing relationship, so that if the goal is to provide baby with all the milk from the birthing parent, then we can do so. And it really is looking at prevention uh, as the best medicine, replenishing the blood and the chi that is lost during birth and as well as during pregnancy, and making sure that the birthing person is nourished. So let's look at breast milk in Chinese medicine. There's a very strong connection between milk and blood. And so what I see and what has been documented is a lot of times if there is a true issue with milk supply, we can actually trace it back and see the harbingers that could have told us that this might be a challenging time based on what the menstrual was like before pregnancy. And that is also explained by the way we look at breast and breast tissue being governed by, in Chinese medicine, we have meridians and we have different names for them, and they do coincide with organ systems, but not necessarily as the anatomical organ, as in there's something wrong with your stomach or there's something wrong with your liver. But the channels that flow through the breast belong to the stomach and the liver channels. And that's important because that's how we make blood and vital energy, right? We consume food, the body breaks that down, pulls the nutrients that we need from it, and eliminates the waste. And then the liver's job is to make plenty of blood. So this flow relies on a healthy digestive system, emotional regulation, rest, and nourishment. All things that we know may be a little bit challenging in this time of life, right? So, as we can see, there is a lot of room. There's a lot of space here that we can attend to help a bodies be in more balance. So those common imbalances and what they look like. So when we talk about in Chinese medicine verbiage called, what we say is qi and blood deficiency, we're not saying you don't have enough blood cells in your body. We're not saying that. We're just saying they're not as strong and as effective as they could be. And what that looks like in the body is fatigue. It looks like you're producing milk, but maybe not enough. And emotionally, it looks a little bit more like depression. Versus something that we would call liver qi stagnation, which, if you think of the word stagnation, can really give you an idea of what this feels like in the body. This feels like weepiness and irritability. For those who have experienced what I like to call liver qi stagnation PMS pattern, you know, your period's coming because you're a little snappy at your loved ones. That's qi stagnation. That's that irritability, that anger that can kind of seep in. And what that looks like in the body with milk production is a tendency for clogged ducts. As we think about things being stuck, things not moving and flowing the way we'd like them to. And then another way we look at it is we use this term called damp and phlegm. And if you think about kind of mucus production, but in places that it really shouldn't be, that's when we see things like engorgement, a tendency to mastitis, and thrush. Now, as we can see, none of these things are going to exist in a vacuum. There's going to be a combination thereof. And this is where, we can kind of dive deep and start looking at how we can support the birthing person in the postpartum period by making sure they're getting enough rest, hydration, and nourishment. So how can we affect this? How can we positively impact this? Well, number one, let's talk about warm foods for healing. We want to incorporate anything warm. I love soups. I love broths. as medicine, I think that there is so much wisdom in creating a deep, nourishing, warm liquid that you can sip on between meals, sip on when you don't feel like eating. As we know, the amount of calories that a lactating body needs is higher sometimes than even in pregnancy, depending on the numbers you're looking at. Um, and so in order to fulfill those gaps, especially when there's a lot of other juggling that's probably happening during the postpartum period, having broths and soups on hand, I feel like is a really nice way of addressing time constraints as well as the overwhelm in how do we feed, right? Adding things like sweet rice, ginger, jujube dates, and goji berries can help support digestion, boost milk production, and again, making sure the body is nourished and balanced. It also helps with the hydration, which is going to come up in just a moment. Um, in Chinese medicine, we use a lot of herbs. So when you think about herbs, think about pre-pharmaceuticals. Basically, a lot of the plants that we're now getting these active ingredients from started somewhere, and they didn't all start in a test tube. So there are a couple of different things that we use that you can actually even find in some grocery stores. For example, dongui is something that is a very common add-in when you go to Asian markets. You can actually find it on the shelves. And then there's a formula that we like to use in Chinese medicine immediately postpartum called Xinhua Tong. It's for short-term use, but it's for that tail end of that bleeding period where we really want to make sure that number one, we're nourishing blood and qi after birth, and two, making sure that the uterus's job of cleaning out has been a truly productive one so that we can start restoring balance to the body and promote overall healing, because a healing body is a lactating body. Hydration, as we know, is so important, right? We are mostly made of water. There's so much water in the milk. Herbal teas, bone broths. If you are a non-meat eating person, utilizing mushrooms in lieu of animal products is an amazing way of still getting all of all the things you can get into a broth that is going to make it nourishing and healthy um, and fulfilling for you, um, aiding in digestion and helping maintain milk supply. My biggest caution, and I know that it's hard depending on the time of year we're giving birth and the weather, but cold and raw foods. That is my biggest, if you don't hear anything else I say today. Postpartum is not the time for cold and raw foods. And again, we've all seen the IG videos of the woman who just gave birth and they come in with this huge sushi platter and my entire body just seizes up. See, this is what happens with cold and raw. It requires more from the body to break it down, because now the body not only has to break it down, but it needs to heat it up. And as we all know, the temperature inside of our stomach is higher than our overall body temperature. So the body now has to warm it up and break down and get what it needs in a shorter amount of time, because food goes through the digestive system at a regular pace. And so now that we have to do more with that time, what winds up happening is we lower the temperature of ourselves inside, which is going to impact healing, because we need good circulation to heal, which gentle warmth is good for that. But we're also slowing down the digestive system, reducing the amount of nutrients we can pull from that food. And as we've discussed, nourishment is a big part of this. Nourishment and hydration are big parts of this. So no cold, no raw, and they made it postpartum. And honestly, if you look at the way they serve sushi, they acknowledge with the presentation that this is a cold food because ginger by nature is hot. So what's served with sushi? Pickled ginger. So it's not only slightly fermented for probiotics, but you're also getting the hot from the ginger, as well as, of course, the hot from the wasabi if you are consuming that. So no cold, no raw in the immediate postpartum. And I really do feel like broth making is a love language. I mean, I think every single culture has collective memories of grandmothers, making some sort of broth or soup when we were ill. And the thing I love about broth is that there's so many ways we can add to it to just supercharge it. I like to, with some of my patients and clients, provide them with their raw herbal formula and cheesecloth. So all they have to do is put that in with their broth, and two two birds, one stone. You're getting your all the medicine that you need as well as getting the nourishment that you need. It's easy to digest. The body can immediately do what it needs to do in terms of building blood, which is going to make more milk. Some of those add-ins, as we discussed earlier, Huang Chi is astragalus. I apologize for not typing that in. I should have. Um, and again, I like to talk to families about 33, 34 weeks and start asking, what does your freezer look like? How much capacity do you have? Can you maybe start making a broth every week or every couple of weeks, something that you can sip on now and freeze some for later or freeze it all for later, so that you can start being well supplied? Because I love to use broth not only postpartum, but also during birth when we know we need more nourishment, but maybe eating doesn't even sound good. And then thinking about acupressure in the body. So opening up the channels in the chest to help milk come down. There's that's where you'll find stomach 18, which is listed here. These are acupuncture points. So just massaging in the chest, massaging the pinky finger. That SI11 milk letdown is right here at the bottom corner of the pinky nail. And massaging that down is very helpful for milk letdown. And then stressed and ducts, again, this is a super simple, you're all going to know where it is. You know that spot right here? That spot right here? That's GB21. That one, the one that you want if somebody walked up behind you right now that you were comfortable with touching you and started rubbing you right here, you'd be grateful. This is a really big point for during birth as well as postpartum in terms of bringing that downward sensation to the body. It really communicates downward. And of course, gentle massage anywhere is going to calm the nervous system and allow the body to do what it needs to do. In Chinese medicine, we use something called moxa, which is the burning of artemisia, or AKA mugwort. We call it. And I actually have created a topical oil that infuses the essential oils of artemisia with jojoba oil to use in lieu of what we do here in the office so that people can use it anywhere, especially with some gentle warmth. But soaks, and we can go as low tech as just putting our feet in some warm water with some Epsom salts to adding herbs in. And I'm always available for consults so you can talk about what kind of herbs you want to put in there, but things that are warming and move blood are the things that we aim for. And again, I do make that oil. If you have questions about it, it's called Womb Rhythm. But honestly, any warming oil would be great for self-massage, And even between feedings for massaging breast tissue, obviously down towards the nipple, doing that right before breastfeeding is always going to help. So I want to be super clear that the I practice this medicine because it works so well with all the things, right? It does, this medicine is not going to replace your lactation consult, but it is going to enhance in terms of providing you with more tools in your at your disposal to make sure we have adequate milk supply, and that we are emptying the breast effectively, not getting stuck with clogged ducts or mastitis and things like that, if possible, and helping to recover quicker if those instances arise. I just had a family who delivered on Christmas Eve. It was their second, and um, things were going well. And then week 3, all of a sudden, as it goes, we've got a clogged duct and we're right borderline on that mastitis. And we were able to get things moving with the foot soaks and with a new herbal formula so that we stayed on the safe side, right? And didn't have to resort to the antibiotics that may have led to a pump and dump situation and having to augment baby's milk supply. And I love to partner with IBCLCs, other lactation educators, doulas, anyone who's providing care in the immediate postpartum with lactation concerns for folks who are looking for more holistic options. So, for those who don't know, I do have a practice here in just outside of San Diego in La Mesa. I have a in-office clinic and where I treat patients. And I offer in-person as well as virtual postpartum care plans. Again, I love working with other professionals. And I am creating more and more tools so that folks can have what they need during these really important times. And I'm excited to open it up for some questions, which I see are already flowing in. So I'm going to go ahead and start, unless there's other guidance. Otherwise, I do see a question and that has popped up in the chat.
Yeah, we can go ahead and jump in that question, and everyone else feel free to put in your questions based on the presentation, or if you have questions about Black Maternal Health Week in general, we would love to be a resource and answer this for you.
So thank you, Ernie, for this wonderful question. The barriers that exist in mainstream healthcare that prevent adequate postpartum and lactation support, um, I think are a lot of the same answers that prevent basic care, right? I think there's this stigma that lactation and nursing your baby is supposed to be something that is very instinctual and you'll know what to do. And really, I think the message that I like to get out there is, if you can physically get to a lactation group before you have your baby, you will learn how instinctual it is not and get more education. I think there is you know, but again, we're talking about more transportation if someone is challenged in that respect. Having access to the resources, um, to a doula. I'm fortunate enough that I'm in the Medi-Cal system as a doula and acupuncturist, but I can only see so many people, and they've only approved so many doulas. I think last number I heard was there's 900 births, Medi-Cal births in San Diego County currently that cannot be fulfilled by a Medi-Cal approved provider. So that's 900 families that may not have the funds to hire a doula out of pocket and then get access to those resources and can make it to a midday lactation group in the middle of the week because budgets are real and work is real and no one's allowing for that kind of postpartum maternity leave that is truly required. So by creating more resources, and I think providing more opportunities like this where we can start saying what are the low tech tools and skills that we can make sure more people have so that birthing families are can be closer connected, I think would be um, ideal in solving some of these challenges. So how can doulas, midwives, and lactation consultants effectively collaborate to create a more integrative postpartum care model? Um, stuff like this, taking the time to, I think I've been in the birth community in San Diego County since 2019. I have heard from a lot of people who are not in San Diego County how good we actually have it here and how there's a little bit more communication here within the community and the way we can support each other. I think understanding what resources exist, where the holes are, and starting to communicate of, okay, so how can we fill them collectively as opposed to um, recreating the wheel as it were. I think there's a lot of us out here who are doing everything we can to touch as many families as possible. But sometimes we're not talking to each other and sometimes we're siloed. Um, and so the more cross communication just as a whole and seeing what each other offer, because I know of birth workers who don't want to be on call, who specifically want to be in this postpartum space and who are treasure troves of resources who just have a hard time connecting with others. So the more of this that can happen, I would love to see an integrative postpartum care model. And absolutely more opportunities like this. I was on it, it's again, I got into this medicine partly because of the way it looked at menstrual health and the postpartum period and how it was such a paradigm shift because in our culture, we all know, all right, you had that baby, get on back to whatever you need to get on back to. But, but also breastfeed because, breast is best. When those two things don't align, when we look at other countries who have a better track record at these things, we're seeing, collective, um, federally mandated, types of maternal leave programs where families can be financially supported and financially okay. And no one's stressing about, well, what are we going to do about rent next month because we had the baby? That's a level of stress that is going to negatively impact milk production. There's just no way it can't. So if we're going to be really honest about it, this is, it's how can we cobble together with our villages that we're creating the kind of support that truly feels nourishing and supporting so that we can provide that parent baby dyad with everything they need. Any more questions? I don't see the Q&A
Yeah,
specifically.
there's one in the Q&A that says, do you offer hands-on training at your clinic? Super interested and would love to seek more certifications to obtain my nursing career in ED.
So that is not something I've explored until recently. I think with the moxa oil that I am just now starting to uh, mass produce, it's something that I can start I want to start thinking about in the future. So thank you very much for the idea. But yes, coming soon. Let's just say coming soon. Knowing that there's a want for it is a big plus.
Any more questions? Give it a couple moments. While we wait, thank you so much, Dr. Shani, for this amazing presentation. I just had a baby a few months ago, and so I definitely can resonate with the what that society tells us to get up and go, but also the need to stop and nourish our bodies and do all the things. And so even I'm in this postpartum phase, and this was super good for me too. Being a birth worker, it's always good to have that reminder as well that like I have permission to slow down and to stop and nourish my body.
And
Uh,
can we say that as a whole, anybody on this call, that you are probably doing a lot, doing all the things, and you deserve rest.
yeah.
Please rest, because none of us are getting out of this alive. Please rest for you and your family and for your community. Um, thank you so much, Leandra, for again, for being present. And yes, and please rest.
Yes.
Get all those baby snuggles.
Awesome. Well, thank you so much. They want to know if you can provide them with an email.
I'm on it.
Add it to the chat.
Mhm.
Yeah, follow Dr. Shani on Instagram and follow us on Instagram, follow SDLEA on Instagram. Um,
Yeah.
yeah, thank you. I will be sending out this recording as well so you can have it for everyone that is here. Thank you so much.
Wonderful. Thank you all for being here. And if I could be a resource, don't hesitate to reach out.
Beautiful. Well, have a great rest of your day. Enjoy your weekend, everyone. And yeah, thanks for being here. We appreciate you guys.
Bye.